Hi there. Today I was having a little bit of low back issues, particularly in my right SI joint. So we're going to do a really brief video for you on how you could mitigate potential SI joint dysfunction. Now, obviously, if you haven't been diagnosed with this and you're self-diagnosing and you think you know what it is, um, I'm not a doctor. I don't diagnose and I don't give you cures, but I can give you ideas on things that you already know is wrong with you or bothering with you. And your job is to say, yes, this hurts. This feels awful. I'm not going to do it. And remember that everything that we throw out in general in the yoga world or elsewhere, if you're just doing it because somebody tells you to do it and it's messing you up, you have the responsibility to yourself to stop. So that's my disclaimer. I'm not treating or preventing any diseases or problems, but I am treating mine. So my SI joints are a little wonky, and it used to cause some intense pain, and through a combination of yoga and about 10 or so years ago, a full 10 Rolfing sessions and some good mindful chiropractic over the last decade or so, most recently in the last year, been able to manage it, and plus I know what to do for myself as well. So I'm going to start with the first thing. I don't know why I have a bolster here because I'm probably not going to use it till later, but there it is. So first thing I like to do is go symmetrical and figure out exactly what the issue is. Now right now I feel it in my right side, which to you guys is over here. So for the right side, it feels a little weird, a little kind of painful. So I take my hands into the crease of my hips where the legs meet, and I just push the legs away from me like I'm trying to pull the muscles down towards the knees. And then I release. I take a few deep breaths. And then I push again, and I see what happens when I breathe in and I push down in the abdominal cavity a little. And then when I exhale and I drop the tip of the pubic bone down and up towards the navel and let the low back curve get more tactile with the floor, I just see what's going on. And yes, it definitely is the right side, because sometimes I'll feel something in the right, and then when I really tune in, there's something going on in the left. So from here, I'll take cactus arms and go side to side. Now when I go to the left, my right side SI joint is probably going to get a little relief. And yes, there we go. And even more so, if I drop the belly a little bit towards the ground, now it's getting a little pinchy. And then I lift my heart, breathe into my belly, drop the belly, and I just got a little popping there. So I just see what works, and then I use the exhale to create a little abdominal lumbar sandwich here as I drop the belly so the legs can move over without aggravating the back. And then I check it out over here. And when the knees go over to the right and the right side's bothering me, as I suspected, now it feels a little bit more aggravated. So I'm going to take myself back to the center. I'm going to let the right knee drop in, but keep the left knee up. I'm going to wiggle a little bit here. Try to keep both sides of my body equally planted from the back, mid-ribs, to the shoulder. Now my right back pocket, or the right back butt cheek here, is a little light. That's okay. Then I let the right knee drop towards the top left corner of the mat. I'm still keeping the left knee up to the sky. I'm just creating a little bit of space so the right half of my pelvis can come away from the sacrum, because in between those 2 points is the little joint where they connect, and that actually feels pretty darn good. Now if I take it back and the right knee stays to the sky, I'm going to do the same thing. My left knee is going to come to the right, but because my right knee is staying to the sky, I don't feel the same tension as when my right knee goes to the right. This is because I'm not cramming the pelvis towards the sacrum in the back of my body. Not that inherently moving over crams anyone, but for my body today, that's what it feels like. And it is good to do it on both sides, although definitely staying longer on the right side. I'm going to come up now. I'm going to cross the right leg over the left. Feels pretty good. Now I'm going to pop my hips up just a little bit, take them to the right, and let the legs go to the left. Now this I feel an immense release. I lost my cactus arms. I took my hands behind my head like I'm in the Bahamas sun tanning. What I like to do here is I like to do a little loop of breath. So I'm going to inhale down the left side body. And then as I exhale, I'm going to pretend like I can take the skin that's between my right top leg and my belly, and I'm going to lengthen the skin on the right side of my belly up towards my ribs. And then when I inhale, I release, inhaling down the left side body and like loop it up the right towards the armpit. This just creates a little bit of an undulation in the body that I find works with back issues, because it's sort of like inviting a watery, floaty sensation into the body, and the sacral area is associated with not just the water element, but in the chakra system with the Svadhisthana chakra, which is also symbolized by water. And a lot of this low back pelvic region is the center for a lot of pressure because we sit a lot. So lumbar spine takes up to 40 pounds of pressure when you're sitting. Ouch, 40 pounds of pressure, not cool. All right, press the left outer foot into the ground to give you a little bit of like a kickstand. And then as you exhale, you can draw the low belly into the body and take the legs out. I'm going to uncross the legs now. I'm not going to do the other side. I'm going to cross the left leg over the right, but I am not going to twist over to the right because I've already determined that bothers the SI joints for today, and so I'm going to skip that. But I did try it a couple times just to see, and I wasn't forceful about it, and neither should you be if you feel that type of pain. All right, so that was pretty good. So now I'm going to take my legs over to the left again, and I'm going to cross at the ankles. My right ankle crosses on top of the left. So I'm sort of hooking my left foot a little bit. So I find that this is a good way to give yourself some self-adjustment. So the tendency is to like sometimes stack the knees. Let the knees just be as they will be. Your pelvic halves aren't going to stack directly on top of each other unless for some reason that gives you like super relief. For me, it feels tension giving. I'm going to pretend like I'm going to pull the ankles apart, and then I'm going to relax. Maybe take a breath in. And then exhale, pull the ankles apart, pretending to pull, and then relax. And you don't have to go super hard. Like I went really hard at first. I'm like, you know what, maybe I don't need that much effort. In fact, try different levels of effort. You may find that the very tiniest bit that you can muster gives you more relief and more nuance in the body than going all out and pretending like you're trying to tear a tree trunk in half. That would take Herculean effort. Maybe that's not what's required here. All right. I'm going to take it to the other side. And when I go to the other side, because I know that twisting to the other side doesn't feel great, I'm going to take a block or blanket or pillow or something. So it's like, oh, this feels pretty good. I'm going to cross left ankle over right. I'm just going to try it a few times on this side. And this feels pretty good. So I'm not going to stop. But if my legs went over more, it might not. But I'm going to try that. Legs coming over a little bit. Still feels okay. Still feels okay. All right, so I'll try it to the max range of motion. This feels all right now. And that doesn't necessarily mean that what I've done is better or worse, but in my body it means that I've done something. I've probably balanced out the SI joint. I may have been able to take it out of its yucky position. Continually just pressing the ankles away. I'm going to take them back to center. Take the knees into the chest now. That might feel pretty good. You may even make little circles, especially if you're on a hardwood floor. So you get a little circle down by the top of the sacrum, closer to your waistline. Then as your knees come away from you, you're going to want a little pelvic floor lift, just a little, because you don't want the back to arch too greatly. My back's arching, but not out of control. And then try different directions with the circles. Know that the slower you go, the more you're going to feel. And really tune into that little spot down there. You're going to go to the pelvic half, through to the bottom tip of your sacrum as your knees come away, and then the next pelvic half. Knees come in, you're going to get to the top of the sacrum. For me, it feels pretty darn good. Your sacrum is shaped like a little pyramid, and the pyramid points down. So just kind of remember that. Now, external rotation, not always the best feeling for me, but if I cross the legs like Sukhasana, this isn't so bad. Drop the belly a little bit. Now, if I had done this first time around, it probably wouldn't have felt that great, but it feels okay. But I want to feel good, so I'm going to take the legs together manually, and I'm not going to do that. Just testing it out. Now, let's take a little internal rotation, right? So feet come apart, knees knock together. Totally relax the back body. Maybe you weight the front of your belly and the bottom of your ribs with a sandbag if you have it, or a blanket, something that's a couple pounds. Maybe you have a small pet that likes to sit on you. I don't know if that's a great idea or not. And then take the feet together. Coming up, it's important not to undo any tension you've unraveled. Coming to one side, take the top hand, drag yourself in, use your belly muscles. Come on up. So that's just a brief thing that you can do. Give it a try. If you have any questions, feel free to leave some comments. And there'll be more videos to come, so stay tuned. Hope you feel good.